If you've heard of buccal fat for the first time recently, you are not alone. It seems to be the latest plastic surgery craze to hit Hollywood, to hit social media. You see Christy Teigen there. McLean Dermatology and Skincare Center founder Dr. Lily joins us now to break down exactly what it is. So let's start there. What is buccal fat and what is buccal fat removal?
Yes, the buccal fat is a tri-lobed fat pocket in the cheeks. It usually starts in your teens and it grows to about age 20. After age 20, it starts getting smaller and smaller, and in your 40s and 50s, it actually shifts. So what happens is people that feel like their cheeks are too wide or they feel like they have too much fat there, opt to get this removed. The problem is that it happens in young women, really young women, and that's who's actually going to get these surgeries. But as we get older, our buccal fat actually shrinks. So when you are older, you actually need that so your face doesn't feel sunken in or hollowed out.
And it's irreversible, right? You can't get buccal fat put back in. So I guess if you decide to go with this procedure, you're looking at a long range of upkeep and maintenance, correct?
Well, once it's removed, it's gone. You can't ever get it back. And if you feel too hollow, it's very hard to fix. So what we recommend at McLean Dermatology is melting of the fat gradually from the outside rather than cutting the fat out from the inside of the mouth. So we do laser procedures or injections of solutions that very, very, very slowly minimize that fat pocket so you're never too sunken.
So outside of the cosmetic changes, what are the risks to your health if this doesn't go exactly right, so to speak?
Well, it's relatively safe surgery, but there are risks with any type of surgery, which includes paralysis of a nerve that you need to, smile or chew. You can have temporary numbness. You can have swelling. I've seen patients have a lot of bleeding after this because the oral cavity where the buccal fat is, they have to remove it from the inside the mouth, is very vascular, so you can have prolonged bleeding and bruising. So it is a risky procedure, but using alternative techniques, particularly in the young women, is probably the better way to go.
You talked about the two different ways to remove or melt the fat. What's the cost differentiation between the two?
The lasers are much cheaper. You can do a slow progressive laser called a radio frequency laser. Over time, there's no downtime. We use a heated laser that has radio frequency over the fat pockets and it melts them. Those run about $200 to $300 a treatment, and you need a series of those. The melting of the fat with an injection called deoxycholic acid is actually more expensive, but it is much quicker to get done, and it can remove more fat. Some people have thicker fat pockets and may need to have that. For people that have thinner fat pockets can get the laser.
Got it. Well, thank you so much. I've seen the hashtag buccal fat removal on TikTok and other sites, but you definitely gave a comprehensive look at what goes along with it. Thanks, Dr. Lily.
Great. Thank you for having me.